holding on 4 different layers, and between these particular layers there are some variations in esophagus, stomach that we have learned. Today we are going to learn about small intestine. Now small intestine is a large coiled tube which is extending into 3 different subparts. We call them as duodenum, jejunum and ileum. So each part have got little bit modifications on them, but overall this small intestine have got the architecture which is more or less the similar. Some parts have got a little bit different morphology, but if we can remember the difference of morphologies in that particular part, it's okay. If not, we just like identify this particular like small intestine and remember this particular architecture or Marco architecture of it. Now this intestine, as we have saying, it's having same 4 layers, like inside out it has got mucosa, submucosa, muscle layer, external, Muscularis Externa and Adventitia, which is the serous layer which is outside most, and it has a lumen inside. The hallmark of the small intestine is that this particular element is helping us to absorb the food material. To absorb the food material, this innermost layer, the mucosa, goes under duplication or increases this particular surface area, so that it gets more time to absorb the food material as it is flowing through. So it increases the length of the mucosa, and by increasing the length of mucosa, it is helping us to absorb the food material in quick time, or else whatever the food material we have taken, it would have been taken like years and months to get it absorbed, which is not happening. It is running through with the peristalsis, and to deal with the peristaltic movement, it has increased the capacity of absorptive surface area. Now to increase that absorptive surface area on the mucosa, it has gone into duplication on mucosal folds. This mucosal folds which has present in here looks like a finger projections, we call them as villi, and we call them as intestinal villi, which has got duplications of the mucosa. So this is a hallmark for this element, that is, it is present only in this particular region, no other place have got this. Now this particular hallmark of this particular structure is that intestinal like duplication or mucosal duplication, we call them as villi, which is present in all the domains, like it is present in the duodenum, it is present in the jejunum and ileum. It has got little bit variations on the shape and size and the degrees of it, but overall it is having the same architecture. So we are not just making this difficult for us to remember what does it shape like in different parts, because we are going to learn the gross things first, then we have years to flow through this like a medical curriculum. Slowly we will learn that. So but at this point we want to just like have a grasp on the basic things which we are not going to let forget. So this is what we are going to see. We are going to see this duplications of the mucosa, we call them as finger like projections, as intestinal villi which are present. Now this intestinal villi is present in the mucosa, that means which layer? The uppermost layer or innermost layer. Now this mucosa having what are the layers? Epithelium, lamina propria and this muscularis mucosa. So this particular layer goes on this particular changes. Then we have the submucosa which is remains to be unchanged, doesn't have any modifications. It has some features but it doesn't have any changes, likewise this particular mucosa has. Then we have the muscularis mucosa, which is this muscular layer externa, which has got like a circular or longitudinal arrangements, and we have this outer coat, we call them as serous layer, which is featureless compared to the epithelium or compared to the mucosa. So the mucosa is a point of concern for us, which helps us to identify this is this, which separates us from rest of the structures like the stomach, esophagus, etc., etc. Now this particular mucosa have got like 3 layers, we call them as epithelium, that means cell layer, then we have muscular mucosa. Now this particular epithelium have got cells, we have to know what are the cells that is present in it, and this particular lamina propria, if you have got like some features that we are going to learn, then we have this particular muscularis mucosa and the submucosa, blah blah blah, all these things we are going to learn. Alright, so this is what, without making things complex, we are going to learn about this digestive system based on the small intestine, and it's split into 3 different parts. We will learn the gross parts of the small intestine of these different features, duodenum, jejunum and ileum has in gross anatomy later on. I am not just going into detail part of it, but it has got something which is related to it. Now this villi is the hallmark for this particular small intestine, which is we are going to keep in mind, and then we are going to see some kind of thing we call them as crypts of Lieberkühn. Some intestinal glands are there. So this particular intestinal glands which are present in it, we call them as crypts of Lieberkühn, which is having that kind of like glandular element which is going to produce some secretions. But largely this particular intestine have got this particular finger like projection that we are going to focus in. So this is what we are seeing here or trying to see. This projections we call them as intestinal villi, and this particular intestinal layer comes from this particular mucosal layer. Then this particular mucosal layer also have deep inside the lamina propria under to this particular cell layer, which has got like glands like this and which has an opening of over there. This one we call them as crypts of Lieberkühn. So crypts of Lieberkühn opens into this particular surface area, produces the glandular secretions in this region. Then we have this muscularis mucosae, then you have submucosa, etc., which falls in it. So this what we are going to start with, the duodenum. This is how it should be schematically looking like. So intestinal duodenum, which should be looking like a finger like projections, which is this mucosa have, and this particular projections we call them as like villi, and this particular villi is lined by the cells which is known as this particular cells which is present in these regions, lining cells. These cells which are present in here is should be like columnar to cuboidal cells of epithelium, but this is single layer. So it has a like a cellularity which is present in this particular layer, and this particular cells also may have brush borders or microvilli which is not visible in case of like the micro magnification that we are doing. Then we have this particular lamina propria which you are seeing here, which is present in here. Then muscularis mucosae separates out, and this particular area we call them as submucosa, and then we have the muscle layer and this externa. So each layers have got some little bit modifications in this particular region to region that we are going to learn on these particular sections or slides. But overall this particular duodenum, if you are going to learn about, have got these four features. This mucosa, tall columnar kind of epitheliums which is having a single layer, may have a microvilli, finger like projections which is always present in all of this particular intestine, we call them as intestinal villi. And then deep inside this particular mucosa into this lamina propria may have this crypt of Lieberkühn and separated by this muscularis mucosa. The feature which this particular duodenum has, the submucosa holds some glands, we call them as this particular gland as Brunner's gland. They are highly branched kind of glands. So see this particular region, these are the glands that we are referring here, which is present under this particular muscularis mucosae and between this particular muscular external layer. So this region basically falls into the submucous layer. Submucous layer, if you have the glands present in it, this is a small intestine specimen likely coming from the duodenum specimen. But we are not digging deep. If you cannot can remember it, fine. If you do not, don't bother. It is okay. If you fail to remember this Brunner's gland or anything which is present in the submucous layer or the duodenum. Then we have the muscle layer which is present in this particular region, which is external, inner circular, outer longitudinal, and Adventitia which is outside most. So this is plain and simple architecture that we have in this particular duodenum region. Mucosa and having this particular finger like projections, we call them as intestinal villi. Intestinal villi are kind of like a projections. We understand why these particular projections are there, to increase the surface area. As the food material is passing, it is getting more time to absorb. So you are recruiting more people to absorb the food material, right, like something like that. And then we have the submucosa. If we find some glands in the submucosa, that specimen is likely coming from this particular area, we call them as duodenum. If you do not see the glands in this particular region, that means it is not from duodenum, it may be from ileum, it may be from jejunum, right. So this is how we can exclude out. But if you cannot remember, that's fine. At your level, if you remember this is a small intestine specimen having these layers, we are good or more than good. Now coming to this particular jejunum specimen, jejunum also have got same architecture as we are seeing here. So same thing, microvilli, intestinal villi which is present in here, and this particular crypts of Lieberkühn in the lamina propria, but this submucosa do not have the glands. So this particular glands which are absent in submucosa makes this particular thing falls into either jejunum or ileum specimen. External layer, muscular externa, more or less same, and serous layer remains to be the same. So this is what you are seeing here, comparing over here. This domain that we have seen before was filled up with the glands. Here we do not see any glands. That means this is coming from not from the duodenum, likely from the jejunum or ileum, could be, right, because we do not know the how the ileum should be looking like. So, this is how it will look like over there. So, this particular region you see that this particular mucosal epithelium which is spaced by these white dots, you see that. More you go down from this particular small intestine from the duodenum to the ileum, we see the more random dots are coming. These are goblet cells which are present inside. So, these are interspaced by this particular mucosal element is a kind of mucus secreting cells or glands which are present as a goblet cells which are spaced in between this particular mucosal cells. How this mucosal cells should be looking like? Looking like tall columnar cells most of the time, it is single layer, may have microvilli which is present in it. Sometimes it may look like a cuboidal epithelium, like square shaped, because of this particular veining of this particular cells itself. So, it should be looking like this particular projections like this. If you see any projections like looks like finger like, it should be coming from intestinal specimen. Then we can look into this particular 4 layers 1, 2, 3, 4, and within this particular 4 layers if you are finding something which falls into the specific category of the small intestine. Now, next we are left with one specimen, we call them as the ileum specimen. The ileum specimen should be looking like this or just like this, which you having that's like all the 4 layers which is present in it. The only difference in this particular layer is that which ileum has, that we have to remember. I would emphasize on remembering the morphology of the ileum. What special thing that ileum has, this particular projections is present on this everything which is you are having this mucosal projections like microvilli, the villi and microvilli. Then we have this particular thing which starts with this lamina propria. Now, in this particular specimen of this ileum specimen, this particular lamina propria may hold some sort of lymphoid aggregates like this. So, that lymphoid aggregates, if you see that present in this particular region, and that particular lymphoid aggregates may go down to this particular region which is known as this submucous layer, we call them as Peyer's patch. So, this particular Peyer's patch is a kind of like a hallmark for the ileum. Now, this particular Peyer's patch is significant. Why this particular Peyer's patch is significant? Because this is a kind of Peyer's patch that we learned before is a lymphoid aggregates. You remember that lymphoid aggregates, we understand there is a disseminated or a kind of like aggregated lymph nodes and spreaded out lymph nodes. The spreaded out lymph nodes, we say that the mucosa associated, and we call them as MALT, mucosa associated lymphoid aggregates, right? Remember that. So, this Peyer's patch is that particular lymphoid aggregate that you are seeing here as a lymphoid collections or nodules which is under the mucosa which is present and denoted as MALT, which is works for the immune system or immune functions on the GI regions. If you have a disease, we call them as enteric fever. In common loose or layman's words, we call them as typhoid fever or typhoid diseases, paratyphoid diseases. If you have a paratyphoid disease which largely affects the GI system, the gallbladder, the liver system as well. So, that particular disease is that particular problem which you have as a disease itself leads to a hypertrophy of this particular Peyer's patch. So, this particular Peyer's patch becomes swollen and becomes very large, and that particular Peyer's patch is growing because to combat the disease inside that is present in the GI system. So, there are hypertrophy of Peyer's patch present in enteric fever or enteric disease that we call them as like typhoid fever. So, in that region or in that regard, this particular Peyer's patch becomes significant. That is why you have to know a little bit about the Peyer's patch. So, this particular Peyer's patch is present in this particular region, we call them as ileum, which is present in it. Mucosa, submucosa, all are having same thing, but only thing is here is the Peyer's patch. How do this Peyer's patch look like this? So, you see that this is finger like projection that you are seeing here is the same intestinal villi which is present. And then we have this particular nodule aggregates like this. These nodule aggregates, if they are enlarged, it may encroach this particular layer below, and this particular muscularis mucosae may fade out, like may spread out or may disintegrate. We may not able to see this muscularis mucosae, and it may look like a same singular, like a continuous corridor. So, this lymphoid aggregate may encroach into submucous layer like this. And this particular lymphoid aggregates you seeing 1, 2, 3, 4, 5, this is kind of like pathognomic or hallmark for the small intestine specimen, that is present in the ileum segment, right. So, if you see this, it is present in this region. It ideally should be looking or present should be the lamina propria level. Some of the books it's written into the submucous level, but thing is that it may reach into this particular lamina propria, which is present in the mucous coat, and if it is enlarged, becomes bigger, it may reach to this particular submucous layer as well. So, that is why it makes it like this. So, this particular small intestine have got like a same general features like this, and this is what we call them as Peyer's patch, which should be present under the villi, but that not should be restricted into this particular region of the lamina propria. It may reach into the submucous layer, breaching this particular muscularis externa, muscularis mucosae, and reaching to this particular submucous coat itself. So, just looking into this particular submucous layer or the lamina propria, presence of this particular lymphoid aggregates, we can separate out the different domains of the small intestine, like belong to the duodenum or jejunum or ileum, right. So, this is how we are going to identify this particular small intestine specimen, but this hallmark is that we are going to identify this particular finger like projections that is present for this particular segment. We should be looking like this, and if you find some glandular collection like this, it should be like belonging to the duodenum, and if you do not see anything, basically that means basically jejunum only, and if you can see some of these particular lymphoid aggregates, that likely be going to be ileum specimen. But even having told that all these things, if you are failing to identify the subsegment of the small intestine, do not bother, just identify this small intestine and having this particular feature, at least have a grasp on this particular small intestine thing. Later on you can just separate it out, it is good, rather super good, alright. So, there are 3 specimens are there, which is been placed in the 3 different microscopes. Try to just like go through things, and again just whenever you are going through, be systematic, like what you are looking and what should be looking for, like lumens and then layers, and what are the layers or sub layers you are going to explore in these times. And if you are seeing between the layers, if you can separate it out whether it belongs to this subdomains or not, if not, just do not bother, fine. If you can remember is as finger like projections with a villi, we are good, we are very good with your identifying.